The dust hits before the sound does. Fine white powder suddenly everywhere, coating your lips and eyelashes. Then the groan, deep, structural, not mechanical. Something in the building's skeleton is giving way. Within seconds, the light changes. Ceiling tiles drop, fluorescents swing. What was a normal corridor becomes a different environment entirely. Most people freeze for 2 to 4 seconds at the first structural sound. That pause is not cowardice. It is the brain trying to classify something new. The nervous system is running a threat assessment it has never needed before. And that delay, brief as it is, shapes everything that follows. Structural collapse does not usually happen in one single dramatic moment. It tends to move in stages, a partial failure, then a cascade. Engineers call this progressive collapse. One load-bearing element fails first. The floors above redistribute their weight to the next available structure. If that structure is already stressed, the chain reaction continues downward. What you experience as chaos is actually a sequence with its own logic. Understanding that sequence, even roughly, changes how you respond. The first physical sensation most survivors describe is pressure, not pain. Falling debris compresses air before it makes contact with skin. A nearby impact can throw a person sideways without touching them directly. This orientation follows almost immediately. Your spatial map of the building is gone. The hallway you knew is now blocked, angled, or simply missing. Your inner ear is receiving conflicting signals: floor, gravity, dust, noise, motion. This is when people make their first significant mistake. They run without direction. Running blind through a partially collapsed structure increases injury risk substantially. Unseen voids open in flooring, hanging debris shifts when disturbed. The instinct to move fast is real and understandable, but directionless movement costs energy. And in a trapped scenario, energy is one of the few resources you still control. If the initial collapse does not trap you, you have a narrow window of mobility. The structure is still settling. Aftershocks or secondary failures remain possible. In earthquake-related collapses, significant aftershocks occur within the first hour in many cases. In building fires that weaken steel, secondary failures can follow within 20 to 40 minutes. Your window for self-rescue may be shorter than instinct suggests. The air quality inside a collapse changes faster than most people expect. Pulverized concrete releases fine particulate matter immediately, particle sizes below 10 microns. These particles penetrate deep into lung tissue with repeated inhalation. A cloth over the mouth and nose, even dry fabric, filters a meaningful portion. It is not a perfect solution, but it reduces the dose your lungs receive. Breathing rate matters here. The faster and harder you breathe, the more particulate enters. Staying as calm as your situation allows is not psychological advice. It is respiratory protection. In the first minutes, the greatest physical dangers are falling objects and footing failure. Debris fields are not stable. They shift under weight, especially in the first few minutes. Moving through rubble requires slow, deliberate foot placement, testing before committing weight. One hand maintaining contact with a wall or large fixed object helps orientation. The impulse to call out for others immediately is natural and sometimes useful, but sustained shouting burns oxygen and produces faster, shallower breathing. If you need to signal, short controlled bursts against a hard surface carry farther. Tapping or striking metal travels through structure in ways that voice often cannot. Rescuers with listening equipment can detect rhythmic tapping through several meters of debris. Darkness is one of the most psychologically destabilizing parts of a collapse scenario. The visual system is the brain's primary orientation tool. Remove it and cognition shifts. Studies on trapped miners and collapse survivors show anxiety spikes sharply without light. Heart rate climbs, breathing quickens, and threat perception becomes less accurate. If you have any light source, phone, lighter, anything, use it in short controlled intervals. Preserving battery matters, but so does giving your brain periodic visual confirmation of space. Knowing the cavity you occupy has a ceiling, walls, a floor, that information steadies thinking. A phone screen briefly activated tells you more than just the time. It tells you the size of your immediate space, debris position, and potential exit direction. That spatial awareness is worth the battery cost used carefully. Now the body begins its own internal response, separate from anything you decide consciously. Adrenaline has already flooded the system within the first 30 seconds of the event. Heart rate in an acute stress response can reach 140 beats per minute or higher. Blood is redirected toward large muscle groups, legs, arms away from digestion and fine motor control. This is why hands shake, why threading something small feels impossible under pressure. Fine motor tasks become genuinely harder, not because you are failing, but because of biology. Knowing this helps. If your hands are trembling while trying to clear debris, that is normal function. The adrenal surge also dulls pain temporarily. Injuries sustained in the first minutes often register later. People have moved through collapsed debris on fractured limbs without realizing it until they stopped. This is not heroic, it is physiology. The bill arrives after the immediate threat passes, which means exit from debris is not always the final problem. Secondary injury assessment matters. In the first 10 to 15 minutes, the psychological state fluctuates significantly. Some people experience a sudden, eerie, calm dissociation, reducing emotional intensity temporarily. Others experience acute panic, a loop of catastrophic thinking that is difficult to interrupt. Both are normal. Neither means the person is incapable of making useful decisions. The practical intervention for panic is the same as for any hyperventilation-inducing stress. Slow the exhale. Breathing out longer than you breathe in activates the parasympathetic response. It does not eliminate fear, but it reduces the cognitive narrowing that fear produces. Tunnel vision under panic literally narrows visual field. Peripheral awareness contracts. That matters in a debris field where the exit or hazard may be just outside your focal point. Slowing breath, even partially, widens that perceptual window and improves situational assessment. If you are trapped, genuinely immobilized by debris, the calculus changes completely. Movement is no longer the goal. Conservation becomes the primary strategy. The body's oxygen consumption at rest is roughly a quarter of what it burns during exertion. Staying still preserves air quality in confined voids longer than movement does. Rescue teams responding to structural collapse work from the outside. They need you to be findable. Urban search and rescue teams use acoustic listening devices, thermal imaging, and trained dogs. All three methods work better when the survivor is still and producing consistent signals. Random movement, shouting continuously, or attempting to dig upward can complicate detection. In some collapse geometries, upward digging destabilizes the debris overhead, closing the void. The space you are in, however small, is often the safest immediate geometry in your area. Structural engineers call surviving voids survivable collapse zones. They form when large, rigid objects, desks, door frames, stairwells, heavy furniture, deflect load. The debris above you is resting on something. That something is what kept the space open. Disturbing the debris field without understanding its load path is a genuine risk. This is one of the most counterintuitive realities of collapse survival. The instinct to dig out is powerful, but undirected digging from inside can remove what is holding things up. If you are going to move debris, move it sideways and downward, never directly overhead. And always pause after each movement to listen for settling or shifting in the structure above. Time perception inside a collapse void distorts in a specific and well-documented way. Minutes feel like hours. The brain, deprived of normal sensory input, loses its clock. Survivors consistently overestimate how long they have been trapped, often by a factor of 3. This matters because despair often arrives not from the situation, but from a false timeline. People have abandoned viable positions because they believed rescue was not coming. In reality, urban search and rescue teams begin grid searches within 1 to 3 hours in most cases. In major collapse events with multiple casualties, that window extends, but teams are still moving. The first 24 hours remain the highest probability window for live rescue retrieval. Knowing that changes the psychological frame. You are not waiting indefinitely, you are waiting specifically. Hydration becomes a real factor after the first 2 hours of entrapment. The body loses water through breath, sweat, and the stress response itself. Dry mouth and mild headache are early signals. Neither is immediately dangerous. But cognitive function begins degrading at around 2% body weight loss from dehydration. Decision quality, spatial reasoning, and emotional regulation all soften before thirst feels severe. If there is any moisture available, even condensation on pipes or concrete, it is worth attention. Cold metal surfaces in humid environments accumulate surface moisture that is collectible. This is a small detail, but small margins are what collapse survival often comes down to. Temperature inside a collapse void depends heavily on the environment outside and time of year. In cold climates, trapped air cools steadily. Core temperature can begin dropping within an hour. The ground conducts heat away from the body faster than still air does. getting any insulating layer between the body and the floor. Clothing, debris, anything slows that loss. In hot climates or fire-adjacent collapses, the risk reverses. Heat buildup in confined voids is rapid. Shallow breathing, wet skin, confusion, and a sense of pressure in the head signal heat stress. The body managing temperature without movement or resources is working against significant physics. There is a secondary psychological pressure that emerges after the acute fear subsides. It is quieter than panic, more like a slow, heavy doubt. The mind begins running scenarios that are not useful, catastrophic imagination without information. The practical counter is narrow focus, not optimism, but task orientation. What is the state of this space right now? What can I assess? What can I do that is low risk? Small, deliberate actions. Clearing debris from around the body, improving a position, testing surfaces. Help. Not because they always change the outcome, but because directed attention stabilizes cognition. Survivors of extended entrapment consistently describe task focus as a psychological anchor. It is not distraction. It is the brain finding traction when the environment offers very little. Around the 4 to 6 hour mark in many trapped scenarios, a different kind of fatigue sets in. Not the immediate exhaustion of panic, a slower, systemic tiredness from sustained stress hormones. Cortisol, which helps manage long-duration stress, begins to dull alertness over extended release. This is the phase where people make quieter, less dramatic errors, forgetting what they assessed, misjudging distances. Allowing genuine rest in short intervals rather than fighting to stay constantly alert is more sustainable. The body under stress is not designed for indefinite vigilance. It needs brief recovery cycles. Real emergencies of this kind require trained professionals, and if you are ever in such a situation, following official guidance and emergency services instructions is always the priority over self-improvisation. The single most useful thing most people do not understand about collapse survival is this. The structure that trapped you is also, in many cases, the structure protecting you. The debris above your head is resting somewhere. The void exists because something held. Your position inside that geometry, however uncomfortable, may be the safest one available to you. Rescue is a process that moves from the outside in, systematically and with equipment you do not have. Your role is not to solve the collapse. Your role is to survive inside it long enough to be found. Manage your breathing, reduce your movement, signal at intervals, protect your temperature, and understand that the body can endure far more than the panicked mind believes it can in those first minutes. What fails people most often in collapse scenarios is not physical limitation. It is the decision made in the first 60 seconds, before the situation was fully understood.